Hello and welcome. Congratulations, you've just started your orthodontic journey. In this video, I'll walk you through exactly how to take care of your teeth with braces, step by step.
Now that your braces are on, the most important thing you can do is take good care of them at home. Let's quickly review your orthodontic home care kit. It usually includes a toothbrush, dental floss, floss threaders, interdental brush, orthodontic wax, a food list, and a hygiene guide.
Each one plays an important role in keeping your teeth healthy while your braces are doing their job. Now, let's get down to business.
Let's start with brushing, the most important part of braces care. When you brush with braces, your toothbrush needs to work in 3 different positions.
The top of the braces, the bottom of the braces, and the front of the braces. Spend at least 30 seconds on each position.
First, place your toothbrush above the braces and gently angle it downward. Use small circular motions, applying just enough pressure so the tips of the bristles slide under the wire.
Brush from one side to the other several times before moving on.
Next, angle your toothbrush upward underneath the braces. Again, gentle pressure, no scrubbing.
Let the bristles clean under the wire as you move across all the teeth.
Finally, brush directly over the brackets and wire using the same circular motion. Take your time here. Plaque loves to hide around braces.
Don't forget to gently brush along the gum line. This helps prevent swollen or bleeding gums during treatment. Also brush the chewing surfaces and the back of your teeth. Altogether, brushing should take at least 2 to 3 minutes.
Brush after every meal or at least 3 times a day. Now let's talk about flossing with braces. Because the wire is in the way, you'll need to thread the floss under the arch wire.
That's where a floss threader comes in. Start with about 18 inches of floss.
Pull 3 to 5 inches of floss through the loop of the threader. Gently guide the threader under the wire, then floss between the teeth.
Hug the sides of each tooth. Don't snap the floss. Remove the floss and repeat this between every tooth.
Next is the proxy or interdental brush. This helps remove food particles and plaque around the brackets and wire.
Gently slide the brush under the arch wire between the brackets. If it goes in easily, that area is safe to clean. If it feels tight, don't force it. Forcing the brush can break a bracket, and we definitely don't want that.
Now let's talk about orthodontic wax. When you first get braces, it's normal to feel sore spots inside your cheeks or lips.
If that happens, wax is your best friend. Take a small piece, soften it between your fingers, and place it over the bracket or wire that's bothering you.
Always remove the wax before eating or brushing. And if you accidentally swallow some, don't worry, it's completely harmless.
It's also normal to feel a dull, achy sensation after getting braces or after adjustment visits.
If needed, you can take a pain reliever like Tylenol or Motrin, whatever you normally use for headaches. Warm saltwater rinses can also help. Mix 2 tablespoons of salt in a cup of warm water and gently swish.
You can also apply oral gel directly to sore areas for temporary relief.
Accidents can happen now, and that's okay. If a bracket, band, or wire breaks, save the piece and bring it to your next appointment.
Be sure to call the office on the next working day so we can schedule you properly. Please don't just walk in. Calling first helps us take better care of you.
Finally, let's talk about food. The hardest part, we know.
Avoid things like hard nuts, pretzels, hard candies, chewing ice, and meat on bones.
Always cut fruits and vegetables into bite-sized pieces instead of biting into them.
Also avoid sticky and chewy foods like caramels, taffy, Skittles, Starburst, gummy candies, and gum.
Eating smart helps your treatment stay on track. That's it, you're all set. We know you'll do a great job.
If you ever have questions or concerns, don't hesitate to reach out. Thank you for trusting us with your smile. We look forward to seeing you at your next appointment. Take care.